I'm Dr. Dworak from Capehart Family Dentistry in Papillion and Bellevue, and I want to talk a little bit about what we're planning to do for the month of February. The month of February is Invisalign month, and we are. This is the only time when we randomly decide to do this. We're giving a $300 discount and free bleaching, and this is the best discount that we give all year round. So if you've been considering or thinking about doing this, and we've talked to a lot of our patients about this, and people have been kind of interested, this would probably be the one incentive I would take advantage of if you're looking to adjust the price a little bit. This is what we use to actually capture your teeth. We don't actually take the wet impressions that you would have had in your childhood, or if you're a millennial, your parents had when they were kids. We actually use a camera that scans and captures all the three-dimensional images of the teeth. It takes thousands of pictures, and it allows us to get an accurate representation of your teeth. And if you look, we can actually give you an example of what your teeth are going to look like before we actually do the procedure. So I don't know if there's many orthodontists that aren't using Invisalign that can show you what your teeth are going to look like in the end. You just kind of got to trust them. I can show you. It's very predictable, it's very safe, and it takes about half the time of metal braces in most cases. As you can see, this patient has all kinds of crowding in her front teeth, and just 6 months of Invisalign, we've turned this into a perfect rainbow, which is ideal, and it lines up a lot better. The lower there's crowding turned canines in overlap teeth, you can see it's just made them perfectly straight. And it works like that if you wear the trays, and it works in about half the time of metal braces. This is what Invisalign is here. We wear these clear trays over your teeth, and you change them every week. They're practically invisible from 5 feet away, and people can talk, eat. We prefer you not to eat. We prefer you take them out to eat, brush and floss. But if you had to eat in a pinch, you could eat with them. But they're very comfortable to wear, and they're very easy. And every movement in this procedure is controlled. With metal braces, you're putting a U around the tooth and pulling the same force on every tooth. It works, and it's worked for years and years, and there's nothing wrong with it. But this is every force is controlled. If this tooth doesn't need to move, it doesn't move. And so it's just very specific, so we do a lot less movements than we have to. We make it as efficient as possible, and that's why we can finish a 2-year case in 9 months to a year in Invisalign. JD's using the camera. It's copying thousands of pictures right now, and it's putting it on the screen, and it's populating. Right now we're trying to get the bite between the two teeth, and once she does that, there we go. It copies it, it decides from landmarks it finds in the tooth where it's going to line that up. And now we have a copy of the teeth that are going on there. And the change in your smile is going to be amazing. In our practice, Invisalign is really important because there's several reasons that having straight teeth is beneficial. And it's not just for cosmetics, even though that is a great reason to do it. Having your teeth in a straighter alignment, not having the crowding that you have here. With this crowding, these teeth are not lining up on the bottom teeth as well, so we're putting pressures in places they're not supposed to be. If we get all the molars lining up in the right position, all the front teeth lining up, the forces are working properly. Your teeth were designed in nature to be it's a very efficient, effective way that it works. And when it's in the right position, it works fluidly, it protects itself. It keeps food from getting caught between the teeth where it can cause cavities. It helps with your periodontal issues. It helps with your sensitivity issues because you're not putting as many forces and stresses on the middle of the tooth by not having a tooth in alignment. So Invisalign is not just a cosmetic thing. Getting your teeth in proper order, to me, is almost as preventative as getting a cleaning. So that's just a tip of the iceberg of what we can do with Invisalign. This is the month that we're going to focus on having straighter teeth, and so please come talk to us, give us a call, and we can get this thing started. As long as you do it in the month of February, you will get the discount.